Hello everyone. Hi, I'm Akil Karthika. I'm a third year medical student. And in this video, we'll be seeing about history taking. Why history taking is very important because it helps in final diagnosis. By history taking, you can predict the final clinical issue or clinical condition. Okay. In this video, I'll be covered about patient profile, chief complaint, history of the present illness, past medical history, family history, socio-economic history, and given a few glimpses about general physical examination and vital data too. First one will be seeing about patient's profile. In this, you have to mention all these eight components: date and time when the patient has visited you and what time it is. Next one is name. You have to address it with Mr. or Miss or Mrs. Next one is age, then sex, whether the patient is a male or female, and religion. Why religion is important means there are a lot of religion related diseases. For example, Muslim women always wear farda, so they may have vitamin deficiency diseases like that. Okay. And then marital status is important because uh, whether the patient have some obg kind of related issues like infertility or pregnancy related problems like that. And then occupation is very important these days because there are a lot of occupational related disorders, that is occupational disorders like asbestosis, silicosis. Most of the lung diseases and skin disorders are occupational related. Okay. Next one is address is important because in particular area one disease may be very prominent, and the other area there may be some other disease will be very prominent and more prone. So address is very very important. Okay. And you have to also get to know who gave the history. Okay. For example, if the patient is unconscious or non cooperative, the attender may have to give the history. Or if it is a child, the attender only or family member will give the history. So you have to take care of this part too. Okay. The second one is chief complaint. Chief complaint may be written as C bar O. This is the main reason for which the patient is trying to seek medical help by visiting you. Usually, a single symptom or occasionally more than one complaint, for example, fever, headache, pain, nausea, vomiting, like that. The patient may describe the problem in their own words and it must be recorded in patient's words. Okay, the complaint must also be recorded with their onset duration, like since how many days, since how many weeks, like that. And it can be asked. And how to ask for chief complaint? You can ask like, what brings you here? How can I help you? What seems to be the problem? Like that questions you can ask. If there is more than one complaint, it should be written according to chronological order. We have already seen what is chronological order. You have to write in a particular order when the disease started or when the symptoms started, for how many weeks or how many days. For example, fever for 2 weeks, productive cough for 1 week, vomiting for 2 days, and fatigue for 1 day. Means you have to write in these order: 2 weeks, 1 week, 2 day, 1 day. In that order you have to write it. Okay. Next one is history of present illness. It can be written as H bar P bar O or H bar O simply. You have to elaborate the chief complaint in detail. Ask relevant associated symptoms. Again, as much as information you can about that specific complaint. Lead the conversation by asking questions. You can always ask an open-ended question. Always start with open-ended question and take the time to listen to the patient story. So that only you can know about the clinical condition. And once the patient has completed their narration, then ask closed questions can be asked to clarify the issue. Okay. um Question type, I have mentioned that open questions and closed questions. You can also ask leading questions too. What is open questions? Open questions allow patient to express their own thoughts and feelings. For example, is there anything else that you want to mention, like that? And closed questions are request for factual information. For example, when did the pain started, like that. Okay. Next one is leading questions. Leading questions are always based on your own assumptions that lead the patient to answer what you want to hear. Okay. And avoid medical terminologies and make use of a descriptive language that is familiar to patient. For example, if you are living in Tamilnadu, you can ask questions in Tamil. If you are living in Kerala, you can ask questions in Malayalam. Okay, like that. And sequential presentation is very very needed, and narrate in detail, so that only when you uh, look back for that information, you can easily get it. Okay. Next one is tip to gather information. You can take a hint like Socrates. Okay. S means sight, O onset, C for character, R for radiation, A for elevating factor, T for timing, E for exacerbating factor, and S for severity. Okay. We will see one by one. First one, sight. Ask the patient whether the symptom is exactly, and whether it is localized or diffused. Ask the patient to point to the actual site of the body. Okay. Some symptoms are not localized. For example, patients who have complaint of dizziness do not localize this to any particular site, but vertigo may sometimes involve a feeling of movement within the head, and to that extent is localized. Okay. Do you understand? Other symptoms that are not localized include cough, shortness of breath, or change in weight, etc. Second one is onset. Mode of onset and pattern is very important. Find out whether the symptom is rapidly increasing or gradually increased or instantaneously present. Example, cardiac arrhythmias are of instantaneous onset and offset. Ask whether the symptom has been present continuously or present intermittently. Present for particular time and better, and for present for particular time. And determine if the symptom is getting worse or better, and if so, if it get better, and when the change occurred, you have to ask that too. Find out what the patient was doing at that time when the symptom begin. For example, severe breathlessness that wakes a patient from sleep is very suggestive of cardiac failure. Okay. And the next one is character. Here it is necessary to ask the patient what is meant by the symptom to describe its character. Okay, if the patient complains of dizziness, does this mean only the room spin around like in vertigo, or it is more a feeling of lightheadedness? Okay. And next one is, for example, indigestion mean abdominal pain or heartburn or excess wind or a change in bowel habit. Okay, if there is a pain, is it sharp, dull, stabbing, boring, burning, or cramp like pain? You can ask any other questions too. Okay. And next one is radiation of pain or discomfort. Determine whether the symptom, if localized radiation, this means apply if the symptom is pain. Okay. Radiation only applies for pain only. Okay. Certain patterns of radiation are of typical of a condition or even diagnostic too. Next one is elevating factor. Ask whether anything makes the symptom better. Okay. For example, the pain of pericarditis may be relieved when the patient sits up. If it is a short sprain or something like that, ice pack will give. Okay. Next one is timing. Find out when the symptom first began and try to date this as accurately as possible. For example, ask the patient what was the first thing he or she noticed that was unusual or wrong. Ask whether the patient has had similar illness in the past. In a patient with long standing symptoms like chronic symptoms, ask why he or she decided to come and see the doctor at this time and not before. Okay. Then next one is exacerbating factor. Ask if anything makes the pain or symptom worsen. The slightest movement may exacerbate the abdominal pain of peritonitis or the pain in big toe caused by a gout. Okay, I given this for your example purpose. Okay, next one is severity. The best way to assess severity is to ask the patient whether the symptom interferes with normal activities or sleep. Severities can be graded from mild to very severe, like we will grade in grading systems. Okay, first, mild symptom can be ignored, while moderate symptom cannot be ignored, but also it doesn't interfere with daily activities too. Next one is severe symptom interferes with daily activities, while very severe symptom markedly interfere with most of the activities that you do. Okay, if it is a pain, you can put a pain grade for your benefit. Okay, you can take a 10-point scale. 0 means no discomfort. 10 means unbearable pain. Okay. Next one is associated symptoms. Here, an attempt is made to uncover in a systemic way symptoms that might be expected to be associated with disease of particular area. Remember that a single symptom may provide a clue that leads to correct diagnosis. Okay? Next one is past medical history. You can denote it as P bar H bar O. Start by asking the patient if they have any medical problems like ischemic heart disease or heart attack before, or diabetes mellitus, or asthma, TB, jaundice, fits, hypertension, like that. Okay, uh, or any mental health issues. If diabetic, mention time of diagnosis or current medication or clinic checkup, etc. Past surgical or operational history, you have to include the time, place, what type of operation. Note any blood transfusion or blood grouping is done. Okay, and then history of trauma and accidents. If there is an history of trauma and accident, you have to mention time, place, and what type of accident too. Okay, next one is drug history. It is mentioned as D bar H bar O, or simply D bar H, or you can also mention some of the physician may mention as H bar O bar D, like that. Okay, always use generic name or put trade name in brackets with dosage, timing, and how long. For example, Rantidin 150 mg BDPO. I will describe what is BD and PO later. Okay, and do not forget to mention whether the patient have taken any oral OCP, oral contraceptive pills, or vitamins, or traditional medicine, or KP like analgesics, like that. Okay, next I will given you for this your note. BD means bis die, that is twice daily. Usually it may be in the morning and in the night. TDS, ter die cementus, or TDI, ter in die. Okay, 3 times a day. Next one is QDS, quarter die cementus, or quarter in die, which means 4 times daily. Mainly it includes 6 hourly duration. Uh, 3 times a day will be about 8 hour gap, and quarter die may be about 6 hour gap. Okay. Next one is main. Main means morning. It also mentioned as om, which means omni main. Okay, and nocti, which is on, or omni nocte, which is during night time. Ek means anti cybum. Remember, cyber means food, so anti cyber means before food. PC means post cybum, which means after food. PO means per orum or os, which is the medicine is taken by mouth. Okay. Stat means statum, which is immediately as an initial dose. If a patient comes with you a poison, you can give an antidote. Now that is a start dose. Okay. Then one is RX. RX means receipt. That is by which you are treating the patient. That is treatment, how you treated with. Okay, next one is very important point, family history. Whether there may be presence of any familial disease or running in the families, because it helps to denote the genetic disorders, okay, like breast cancer, ischemic heart disease, diabetes mellitus, developmental delays, like that, okay. Next one is socio-economic history. You can write in this way, or else you can write in personal history too. I will explain. In personal history, you can write diet, whether they are vegetarian or non-vegetarian, or they are taking mixed diet. In appetite, you can write as good or moderate or poor. In thirst, you can write, ask about how much water they are drinking, whether they have an increased thirst or decreased thirst. Normally, it is 2.5 liter per day. Whether they are taking above that or below that, you have to mention, okay. Next one is sweat, whether they are having excess sweat or moderate sweat or not sweating at all, that is poor sweat, okay. Next one is bowel and bladder. You have to write frequency. If there is if it is normal, write regular and normal. If it is there is an abnormality, you have to mention each point, whether they have a constipated, polyuria, hematuria, anuria, or they have amaturia, oliguria. If it is an bowel, you have to like whether they are constipated or they have diarrhea or dysentery. If diarrhea means loose or watery, you have to write all that, okay. And whether they have pain or not, you have to mention all the things, okay. Next one is sleep, whether they have a sound sleep or disturbed sleep. If it is disturbed, which time, how many hours, due to what, you have to ask all these questions, okay. Next one is habit. You have to ask whether they consume tea or coffee or occasional drinks, etc. Then next one is occupation and lifestyle. Occupation, what they are doing, because it helps to diagnose occupational disorders. And lifestyle, whether they are living a sedentary lifestyle or moderate lifestyle or heavy lifestyle, okay. Next one is living condition. You have to mention here about environment and their housing, okay. uh, they are whether they are living in an open space or closed space or congested house or well ventilated house, you have to mention all these things. Next one is addiction. What kind of addiction they are, whether they are addicted to drug, alcohol, cigarette, tablets. Some people may also get addicted to enema too, okay. Next one is recent travel history. This is to assess the climatic changes, because people travel to abroad these days. There may be climatic change from India to some other places, so you have to mention that too, okay. Next one is general physical examination. It is a broader point. You have to mention all these things in general physical examination, whether they have well built or poorly built, they are well nourished or poorly nourished. In built, you have to mention like lean, thin, or moderate or obese, like that, okay. In eyes, whether clear and normal or desist. And in nails, whether they have a normal nails or they have a clubbing, spoon shaped, yellowish, or drumstick, peacock brick shaped, or hypertrophic osteoarthropathy, like that. If there is condition present like this, you have to mention that. And in palar, icterus, cyanosis, lymphadenopathy, you have to mention whether they are present, positive, or negative, okay. In edema, if present, you have to write what kind, whether it is a pitting type or non-pitting type, okay. And you can also include height, weight, BMI, like that. Oops, I missed it. Tongue. In tongue, you have to write whether it is coated or clear one, okay. Next one is vital data. In vital data, it is very necessary if the condition related to most of the conditions are related to vital data only, okay. Pulse rate, heart rate, respiratory rate, blood pressure, temperature, and jugular venous pulse. You have to mention all these things, okay. Why we are needing vital data means heart rate is important to calculate whether they have tachycardia or bradycardia. Respiratory rate is needed to mention like tachypnea or bradypnea. In temperature it is necessary in some kind of conditions whether there is only evening temperature rise. And you have to also mention whether JVP is raised or normal, that is jugular venous pulse is raised or normal. Okay, that's it for this video. Next one we will discuss more detail in all systems, and I will also try to mention some of the general physical examinations too. Thank you and have a good day. Bye.